Welcome back to the Healthy Lifestyle Show, where we bring in experts to share their healthy lifestyle journey along with their tips, tricks, and techniques. I'm your host, Bonnie, and today we are discussing matters of the heart, medical matters, that is. So our guest today is Dr. Jennifer Haythe. She has been a doctor for nearly 20 years and is a practicing cardiologist as well as the assistant professor of medicine at Columbia University Medical Center, as well as the co-director for the Women's Cardiovascular Health, where they offer a comprehensive prevention program designed to prevent and reduce a woman's risk of heart disease, which is the number one leading cause of death among U.S. women. With her passion and mission to bring awareness to heart disease, she has helped co-create an app, which is called the Love My Heart for Women by Columbia University, which is an aid to help monitor your heart plan easily to ensure your lifestyle keeps your heart healthy. So let's welcome Dr. Jen to the show. Hey, Dr. Jen, it is so wonderful to have you as a guest on the Healthy Lifestyle Show today.
Hi, thank you so much for having me.
Yay, wonderful. I'm feeling blessed that you are here to share your knowledge and wisdom about heart health with me and everyone today. I would love if you could share with us about your healthy lifestyle journey and why you have chosen to specialize in women's cardiovascular health.
Well, I am a doctor, and I think I was always a pretty fit and healthy person for the most part. You know, medical school can be a little bit tiring at times, but I ran a marathon during medical school, and I became a runner at that time in my life, probably after college more even than before. I was a big horseback rider when I was younger, and so I was always pretty healthy and fit. And then as I went through medical school and residency, I realized how important it was to be healthy because, you know, I had very long hours, I didn't sleep sometimes, and I was taking care of a lot of sick people, obviously, and exposed to a lot of sickness. So I felt like it was really important to eat a healthy diet, to exercise, and to get a lot of rest when I could. And then it just sort of evolved when I had kids, and now I'm an attending. I just have continued to incorporate healthy lifestyle, into my day-to-day. I do the trainer twice a week. I try to do yoga. I do some meditation, and definitely always try to stick to a Mediterranean diet and eat healthy.
Oh, yeah.
As far as my interest in women, I really, I always enjoyed cardiology. And it became pretty clear to me, cardiology was a very male-dominated field in terms of the kind of, the doctors tended to be men more than women. And then, so I was attracted to it in the sense that I felt like there weren't enough women and they were underrepresented, and that I know that a lot of women like to see other women as their doctors.
Yeah.
And I felt like in cardiology, there was so much we could do to help people. We had a lot of medical therapies. We had a lot of knowledge about risk factors, and a lot of those risk factors were very modifiable with diet changes, exercise changes, lifestyle changes, and that was very appealing to me. And then when I realized that, I didn't know this at first, but, heart disease is the number one killer of women in this country, more than all cancers combined. And I realized how few women knew that. And even in the medical profession, doctors were really undertreating women. Women were not being treated properly in the emergency rooms. They weren't getting the care that they deserved. And so that became really important to me to try to raise awareness for women.
Wow, I think that's so important. And I love how you stepped into the role of, the voice for women and helping out, for sure. Could you explain a bit about heart disease and some known facts?
Yeah, so heart disease is the leading cause of death in men and women, and it is an interesting disease because it's really very multifactorial. So, unlike cancer where there's some kind of a genetic defect that gets propagated, in heart disease it's really so many different risk factors coming together, which makes it slightly harder to treat in some ways, but yet gives us a lot of opportunity in other ways. So, the risk factors for heart disease include high blood pressure, high cholesterol, obesity, sedentary lifestyle, smoking, diabetes. In women, preeclampsia during pregnancy is now an identified risk factor.
Mm.
And so, there's a lot of ways to diagnose these risk factors and treat them and then try to get under control. And in terms of heart disease, there's a lot of different forms of heart disease. I mean, I think when we think about heart disease, we think about coronary artery disease, which is a plaque or a blockage in one of the arteries of the heart.
Yeah.
And if that becomes blocked and you don't get blood flow to the heart, that part of the heart can die.
Ooh.
And that can be fatal, or it can just cause a scar in the heart. And that's a problem. But there's also heart failure, and there's arrhythmias, and there's a big variety of valve disease. So there's many different types of heart disease.
Mm-hmm. So what exactly happens to the heart, like during like a heart attack, or does like the heart stop beating? And is that different from cardiac arrest and a stroke? Those are all different things?
Yeah, they're all different. So there's different kinds of heart attacks, but in the traditional, heart attack that we think of, what happens is a plaque that was in the inside of the artery, sort of think of it like a speed bump inside the artery. If that ruptures and then a bunch of your blood cells come to patch up the rupture, it blocks the entire artery and blood can't get down to the heart. And so that manifests in chest pain. It can manifest in a cardiac arrest. It can cause arrhythmias. Sometimes people don't feel it at all if it's a small blood vessel or if there's other blood vessels helping feed that area. So it can have all different kinds of symptoms and different kinds of outcomes. The traditional heart attack on the street is usually a complete blockage of a main artery, and that causes, the heart to either have an arrhythmia or to stop altogether. And that's why, sometimes you'll see need CPR or they need to have their heart shocked. That's sort of what happens. A stroke is when you either have a blood clot that goes to the brain or a blockage in the arteries feeding the brain, and that causes something in your brain to happen. So that's like kind of the same thing that happens to the heart, but in the brain. And in that case, people will develop neurologic symptoms like numbness, blurred speech. They can have a seizure, many different kinds of manifestations.
Wow. Thank you for clarifying that, for sure.
No problem. Yeah.
So what are some prevention techniques that people can take?
So I think that what I try to tell my patients and people in general is that, throughout your life, the best way to prevent heart disease is to lead a healthy lifestyle throughout. Now, obviously, that doesn't mean that if you didn't, you can't adopt one. But I tell women in their 20s and 30s to be, vigilant about what they eat, about having a checkup every year, to have their blood pressure checked, their cholesterol checked, their thyroid checked. They should make sure that they exercise 3 to 4 times a week if possible. They should maintain a healthy weight. And they should be very aware of their family history, and obviously never smoke or do drugs, and alcohol should be in moderation, because all of those things are really toxins to the heart. And then, depending on who you are, what you have, if you've been diagnosed with high blood pressure or diabetes, being very aggressive about managing those risk factors will minimize your risk of heart disease. So if you have diabetes, getting good control, keeping your blood sugars in range. If you have high blood pressure and you've tried diet and exercise and it hasn't gotten your blood pressure down, which may be the case, taking medication, meditation, things that might, further lower your blood pressure, doing yoga. And then, for people who are overweight, I say it's not as much being overweight. Being heavy is okay, and it's being really obese and doing no exercise. If you're active and exercising but have a little bit of a higher than normal body weight, that's okay. It's really, a sedentary lifestyle where you sit on the couch, watch TV, eat, bad food. And then finally, your choices and healthy choices for food are really crucial.
So balance is super important between healthy lifestyle and exercise and diet and stress levels. So what are some, what does a healthy heart diet look like? I know you kind of mentioned the Mediterranean diet.
Yeah, so the Mediterranean diet is a nice diet to sort of start with, depending on who you are and what your cholesterol profile looks like. But in general, we tell people to, stick to olive oil, try
Mm-hmm.
to avoid butter, try to avoid fried foods, eat a diet rich in fish and legumes, nuts, fruits and vegetables. Stay away from processed foods, which are really bad for you.
Mm-hmm.
Stay away from foods very high in saturated fats. Like I said, deep fried food. You go to different kinds of restaurants, they served a lot of processed and deeply fried foods. Those are really bad for you.
Mm-hmm.
And then if you live sort of a healthier, cleaner lifestyle with your diet, you find that you have more energy, you feel better, you're not as tired, you don't have as many ups and downs in terms of your sugar levels. And so you just generally feel better.
Mm-hmm. Yeah, I believe like diet is such a huge effect on what people, because what you eat is how you're going to feel, right? So it's so
Correct.
important.
I agree. Mm-hmm.
Yeah. I mean, it's so hard sometimes when you're enjoying such a good meal and you just want to keep eating more and more and you get into bad habits. But
Right.
balance,
Well,
right?
I think that our society is so obsessive, and so we feel
Mm,
like we have to go like all or nothing, and it's like, binge eating, or like going to a diet where you have like 4 nuts for breakfast and you don't have any dairy. And I'm a big proponent of moderation. Like, just let
moderation.
yourself enjoy a balanced diet and don't eat garbage food. So you can have like that delicious chicken, or you can have, beautiful vegetables and fruits, and but don't overindulge, and don't underindulge, because then you'll be craving it. Just be very
Right.
moderate. Skip breakfast skip dessert most of the time. And then if there's one night you're out and there's a beautiful dessert you really want to have, then have some. Or don't eat the whole thing. Have a couple of
Mm-hmm.
bites. Yeah.
And take it to
Try
go.
to steer away from, the pressure that society puts on us to, like, it's all or nothing. It's sort of
Yeah.
I have this thing that I can't stand about kids and their diets, where parents tell their kids that they can't have dessert unless they finish their food on their plate. And
Mm,
to me, that's really counterintuitive to teaching young people, and even little kids, how to know when they're full. Like, if they're full after, they're not going to starve to death. If they're
yeah.
full after they eat most of their plate, then they can have a small dessert. It
Mm-hmm.
doesn't, you shouldn't be, rewarding someone with a dessert because they ate more than they would have, naturally. So that to me seems like we're already setting up a very strange dynamic with
That's
food
so
from a young
true.
age.
I've
Yeah.
kind of experienced that myself. I was at a Vipassana meditation retreat and being very mindful of like what you eat and what you crave. It was really
Mm-hmm.
cool. And I as well grew up like finish everything on the plate, right? Because you don't want to waste food. And but it was nice because I was in Thailand, so I could actually just like kind of when I realized I was full, I just kind of threw my scraps into the forest and the chickens could eat it. So I didn't like have that the bad
You know,
feeling bad. Yeah. But it's
Well,
like
I think that that's another thing, is that if parents are putting food on a plate for a child and they're thinking about their own appetite, if a
mhm,
child put the food themselves on the plate, they might not
yeah.
put as much on the plate to begin with.
Totally. And then who is end up eating the food afterwards? Because my family, my dad would take all the food from what we couldn't eat. We called him the human garburator.
Oh,
And
yeah,
he'd
totally.
eat all the leftovers on the kids' plates.
Right,
Yeah,
exactly.
so funny. I did kind of hear about this DASH diet. Can you explain a little bit about that or?
Yeah, the DASH diet is a diet that's designed to minimize salt intake for people with
Okay.
high blood pressure.
Mm-hmm.
And, it's just teaching people to be very mindful of how much salt or sodium is in all the food that they're, consuming, and that many people aren't aware of how much sodium is in the food that they buy already. So people will come to my office very often and I say, "Are you eating a low salt diet?" And they'll say, "Yeah, I never put salt in anything." And I say, "Yeah, but did you go to the deli and get a prepared food, or do you
Right.
get a piece of pizza, or do you eat Chinese food?" Like, all of that has salt, or, a
Totally.
canned soup has tons of salt
Oh,
in it.
yeah.
So you may not be adding salt, but you are still taking in a lot of salt.
Mm-hmm.
And actually in the US, to eat fine food that's prepared or pre-made or in a fast food scenario that's very low in salt is not easy. And I
No.
realize that it's hard for people to make their own meals sometimes because they're very busy or they're working two jobs, or they're tired at the end of the day and they just want to pick something up. So in the DASH diet, it's a very structured program to teach you how to minimize salt.
Yeah. And it is so important to lower the salt levels. And with all the processed food and restaurants out there, it is, they just kind of like load it up with salt. And that's kind of what makes you come back for more in a way, right?
Right. That's why it
Mhm.
tastes so good.
Yeah.
Exactly. Yeah. So that's why I try to encourage people to flavor their food with things that they might not normally think would give flavor, like garlic
Mm.
or, olive oil and, a little bit of sherry vinegar, or something that's, flavorful on, tomatoes or an avocado or something that has flavor of its own that you mix with more of a flavorful sauce that doesn't have salt in it.
Yeah, I think that's a great tip. Thank you for sharing that. Mm.
Yeah, no problem.
So, what are some other effects, like such as stress levels? I know that can have a huge impact on a healthy heart as well.
Yeah, so we really, I think, don't have a great understanding of the connection between the mind and the heart. And although we know that there is a very strong one, and,
Mm-hmm.
there's a couple of examples of that. I mean, people who are very stressed, it's not just that you're stressed in your brain and you feel stressed out about something, it actually causes a release of your stress hormones like adrenaline and epinephrine. And those hormones in your body cause you to have a change in your cardiovascular system. It causes your heart rate to go faster, causes your blood pressure to go up. So it's not a total surprise that in certain stressful events, people might have a heart attack because their heart rate goes up, their blood pressure goes up, they might have a pre-existing condition and it gets triggered.
Mm-hmm.
And then there's some theories that stress causes chronic inflammation and
Mm-hmm.
that inflammation has an effect on the heart. And then we know for very well that there is a condition known as Takotsubo cardiomyopathy or stress cardiomyopathy, in which more common women than men have a very stressful life event, like a death of a family member, a divorce, a very big fight with someone, and then they develop really crushing chest pain. They go to the hospital.
Mm-hmm.
Their EKG looks like they're having a heart attack, but when they do a catheterization, there's no blockages, but their heart is sort of ballooned out. And in Japanese, Takotsubo means octopus trap heart. And so they thought that the heart looked like an octopus trap because it was sort of swollen and blown out. And so there's
Oh.
a very obvious visual finding that happens to these people, and they have a heart failure syndrome. They usually completely reverse back to normal when treated with, good heart failure medications, and it doesn't cause permanent damage. But it's a very interesting pathophysiologic reaction that happens where usually a woman has a very stressful event and really develops this acute heart failure syndrome.
Uh-huh. Yeah, that's so interesting because I was
Yeah,
actually
and it's
wondering.
not well understood. Yeah, go ahead. Sorry.
Oh yeah, yeah. I was also wondering, like, kind of like on a metaphysical level, just because the heart is so highly linked to like our like the love in our life in a way, right? It's like the heart
Right.
organ. So that's why I was wondering if like having a healthy, loving relationships with yourself and others like affects the heart. And yeah, it's probably not researched too much, hey?
No, it's definitely not.
It's
It should
hard,
be
I
researched
guess.
much better.
Yeah.
It is good to research because, there's a lot of confounders, and also it's hard for us to quantify stress when we're doing a research study. So, with research studies, it's very easy. The person has, let's say you have a tumor and you give them a medication and the tumor gets smaller, yes or no. With stress, everybody feels stress differently. They may describe it differently. It's hard to quantify it from person to person, so it can be very complicated to study.
Yeah, that's right. So, is there like certain ways that maybe somebody could go about like lowering their stress levels in a certain scenario?
Well, I think that a lot of people shy away from meditation because
Mm-hmm.
they have this idea that meditation is really either they think it's silly or they think it's very complicated and that you have to take a course and it's a whole thing. And it really, obviously there's all different levels of meditation, but
Mm-hmm.
this is the one place where I think technology comes in handy. I think that people can download these free apps like Calm is one, or there's a couple of them where you just download it and listen for 5 minutes, 10 minutes, 15 minutes, however long you want. And it's just
Mhm.
sort of a talking guided meditation, even for 15 minutes a day, 10 minutes a
Yeah.
day. Do it when you wake up in the morning before you get out of bed and get in the shower. And it really, I think, does have a significant impact on your stress at that moment, but then also throughout your day, if you can
Mhm.
start your day at a lower level of stress. Another thing I really strongly advise people to do for stress, besides exercise, which is an excellent stress reducer, but is sleep. I
Yeah.
think that, we are starting to now have a lot of celebrities and people be much more vocal about sleep, but I think that, at least 8 hours of sleep a night is really important, not only for stress, but for overall health. I mean,
Mm.
people are much more likely to get sick, catch colds, if they haven't slept well, or if they went out and drank too much and didn't sleep enough and then had to go to work. The healthier you keep your body, the better it's going to work.
Mm.
It's really a machine that way.
Yeah, totally. And we all know
Yeah.
what it feels like to live on like a few hours of sleep, right?
I know, and it doesn't
It's
feel
not
good.
fun. It's not.
It really doesn't.
No. I really liked your
Definitely.
your tips on meditation, and I feel also that a lot of people are reluctant or scared to try it. And
Right.
there's so many different ways of meditation, and it's just mindfulness, right? To be mindful and just to etch out a little bit of time just to breathe and kind of release all the worries in the day. Yeah, I think that's important.
Yeah, exactly. And just have like a minute to yourself to just process everything in a calm way, or
Hmm.
get rid of all your thoughts and have a few minutes of not having to think about anything if you're
Yeah.
capable of doing that. you know.
Yeah. And you can Google some or get apps about meditation as well. So that's always easy to do. Mhm.
Yeah, I think people would be surprised how, if they downloaded an app and listened for a few minutes to a guided meditation, how quickly they would feel relaxed.
Yeah.
It's very relaxing. I've done it a lot, and at the first I was skeptical.
Yeah.
There's
Something
part of me,
new.
and I was totally blown away.
Uh-huh. That's so
I
great.
just really felt like really relaxed. It puts you in a little bit of a trance. You just like, the voice is so soothing and really helps you just, find that inner peace, which
Hmm.
is hard to do in today's world, which is very
Yeah.
stressful for many reasons.
Hmm. So
Yeah,
lower the stress and do a quick, even 5-minute meditation, right? That'll
I
help.
agree. I agree.
Mhm. I did,
Definitely.
I heard you mention an app, and I kind of jolted me to remember that you are also working on an app, or you have one.
That's right. Actually,
Yeah.
yeah, Columbia University, we designed an app. It's Love My Heart for Columbia University, and it's
Mm-hmm.
available on iTunes. And basically, it's just a risk calculator specifically for women.
Mm-hmm.
So it's free. You download it, and then that will ask you a series of questions: how your height and weight, what your family history is. Basically trying to ascertain your risk factors, what your blood pressure is, and then based on all the information you've put in, they'll tell you if you're at low risk, medium risk, or elevated risk for heart disease. And based on what you're, stratified at, you can select if you'd like to be given tips about how to help those particular areas where you might be more at risk. So,
Mm-hmm.
if it's blood pressure, they'll give you tips about lowering your blood pressure. If it's not getting enough exercise, they'll give suggestions on how to incorporate exercise into your daily routine, even if it's not standard, like dance around with your kids for a little bit, or,
Yeah.
walk to go pick up your lunch, but take a walk, the long way to get there, or,
Mm-hmm.
just different little tips that might be helpful.
Mm-hmm. That's great. Yeah. Definitely take a look out for that app. I'll even like put it in a link in our podcast blog for everyone to find.
Yeah, that would be great. I mean, I think what we're really trying to do is raise awareness for women, because
Mm-hmm.
women have been really in the dark about their own risk of heart disease for a long time. And I think, that's for a lot of different reasons. One, we live in a very male culture. Two, I think media has portrayed heart disease as a man's disease for a long
Right.
time. So you'll see movies and books, man is clutching his chest, playing
Mm.
tennis or having sex. And sometimes it's like a sweaty, smoky alcohol guy, or kind of overweight. And there's all different, or the power man who CEO and he's really stressed out. And that's all great, but they're sort of forgetting about the entire other half of the population that's dying from the same disease. And so I think women not only aren't aware that it is a risk for them, I think many more women would say that they're scared of getting breast cancer,
Right.
which is interesting because it's really such a lower risk for them than heart disease.
Mm-hmm.
And I think that the other problem is that women can't identify other women in their life with heart disease, which is also strange considering that that's how most women are dying. And so either they're not talking about it, they're not realizing how women in their life are dying, or that women in their life have it. I think women may be embarrassed to talk about it because they think it's stigmatized. Like I said, it's like, are you fat? Are you smoking? Are you unhealthy? And, obviously there are certain risk factors that contribute to heart disease, but there are also runners who drop dead of a heart attack. And there are people who are totally healthy, who have a very strong family history. And then another way to look at it is, rather than seeing it as a negative, see it as something you could actually change. I mean, if you get breast cancer, you get breast cancer and you have to get chemo and whatever. If you have a heart disease and your cholesterol is high, you can actually do something to change that, or you could start exercising and you can lose weight. And so it's really like there's so much you can actually do that I try to encourage women instead of discourage them and say, don't feel like it's a diagnosis that you're embarrassed about. Think of it as a diagnosis that there's so much you can do to change.
Yeah, that's so great.
And I want, women to see their doctor, go for their annual checkup every year, ask their doctor about their risk of heart disease. Because a lot of doctors themselves don't know that women's risk is greatest in heart disease, and that's also an embarrassment that we need to correct.
So that's why we're here raising awareness right now.
Exactly. I mean, until 2000 or even later, women were only accounted for about 30% of clinical trial participants. They're just not represented in the studies of drugs and devices and therapies, and they need to be, we need to demand that the FDA and drug companies have a 50-50 ratio of men and women when they study different drugs, because they may affect men and women differently.
Yeah, which also leads me to the question, are there different symptoms between men and women for heart disease?
Yeah, well, so this is a big study that came out in circulation with the American College of Cardiology released this important statement on women and heart disease and myocardial infarction, and that women really have, chest pain is going to be the number one symptom in men and women, but women are much more likely to have vague symptoms of atypical chest pain, pain that's not the traditional sort of crushing middle of your chest pain. They're more likely to feel short of breath. They're more likely to describe feeling very fatigued. They may be more likely to say that they feel dizzy or that they have palpitations. So their symptoms can be more vague than men, and that's very important to be aware of. A lot of women, again, this is my getting on my soapbox, but for so long we say, oh, she's hysterical, she's having a panic attack, she's anxious. But if a man comes in saying those things, we don't say he's having a panic attack, right? We say, could he be having a heart attack? And then we do a workup, and women need to be treated the same way. Maybe they are having a panic attack, but he might be having a panic attack too, but you have to make sure they're not dying first, and that's the most important thing.
Yeah, right. It's important.
For sure.
Well, I thought maybe you could give us your top 3 foods that maybe are really heart healthy.
Okay, I think that nuts are really good for people. Things like not peanuts doused in salt, but almonds, and walnuts. Things like that are always good, and they have a little bit of healthy fat in them. I'm a big fan of blueberries and berries. Now, I don't want to. I'm not promoting juices because I think juices are really bad and full of sugar, but real fresh fruits, blueberries, raspberries, strawberries, I think are really good for people. And then I'm a big olive oil fan. So I try to tell everybody to use olive oil always to replace butter as much as possible, whether they're eating a piece of toast or if they're cooking or making popcorn themselves, use olive oil. You don't need to use Mazola corn oil. Those are not healthy for you.
And in salad dressing instead of salad dressing.
Exactly. Salad dressing, I always like, garlic, olive oil, and a little vinegar, and it's delicious, and fish. So fish is great for your heart. Obviously, try to stay away from the fish that has too much mercury, but in general, fish is a good staple to anybody's heart diet.
Beautiful.
And
Those
stay
are
away from soda. I say no
soda.
fat, never walk into a fast food restaurant again if you can help it. Try not to drink soda and juice. Those are my pet peeves.
Soda. Is it because it's loaded with sugar? Is there a certain
I mean,
effect
it's
of
so
sugar?
much sugar. I don't even think people realize how much sugar. I
Yeah.
mean, you go to one of those juice places now and get like a Jamba Juice or whatever juice. I mean, that's like 10 packets of sugar.
Yeah. That's
Yeah, I
crazy.
mean, imagine pouring 10 packets of sugar into anything.
Yeah, your
I think
coffee.
that my tip for people in terms of their diet as sort of a healthy lifestyle tip would be try to go a week where you don't eat any, heavily refined sugars and processed foods. Like get rid of the chips in your house, get rid of the Entenmann's cookies and donuts, and try to just eat real food. Nothing that was made in a factory that way, and just see how you feel at the end of the week.
Awesome. Yeah, I was just going to say, let's go over our healthy lifestyle challenge. So, is that one that you would recommend for
Yes,
like a
that's
heart?
definitely one of them.
Yeah.
And I don't even want people to start weighing themselves or getting on the scale. Just say, I'm commit for 1 week. I'm not
Yeah.
going to buy any chips. I'm not going to get a slice of pizza with processed cheese on it. I'm not going to, eat anything that was made in a factory.
Uh-huh. So, stick away from the processed food.
Correct.
Yeah. That's hard for some people, right? Because
It is
maybe
really hard.
try shopping the perimeter of the grocery store. Most processed food is in between the aisles, I would say, right? I don't know.
That's really smart. You're totally right. It
Yeah.
is.
I mean, when I go shopping, I eat vegetarian diet, so I normally just go into the produce and then just pick a few things here and there, but it really cuts down your time in the grocery store.
I know it
So,
does. Or go
yeah.
to like an open market, if there's a green market or one of those farmers markets once a week, go and stock up on some nice fruits and vegetables, make yourself a nice
Yeah,
salad.
so good. And
Yeah.
um create a shopping list before you go so you're not tempted to buy those junk food items that are possibly even on sale, tempting you even further.
I
Right?
know, it's so true.
Yeah.
I
Is
know healthy eating can be more expensive, which is hard. I
mm,
understand that.
yeah. And there's so many good fruits now that it's summer, so that's good
I know
too.
so many. Make a delicious tomato salad.
Mm,
You can put some fresh cheese or mozzarella in it. For
yeah.
breakfast, have an avocado. My husband's been doing this thing where he, makes a sweet potato in the morning with a fried egg. But
Wow.
again, like it's really filling, but it's not that many calories and it's healthy.
Yeah.
It's an egg with not, he doesn't use butter and he just makes it or a soft boiled egg and, a sweet potato and that's, a great breakfast or put it on a bed of lettuce.
Hmm. Yeah.
Be creative.
So many healthy options. I love it.
And oatmeal, that's another good option for
Mm.
people.
And you can add some yummy berries and get your sweetness
I
that way,
know.
right?
Yeah, exactly. Or if you're dying and you can't take it, like a little honey,
Hmm.
something a little bit of more of a natural sugar.
Yeah, natural sugar is so much harder to find, but so much better for you. But yeah, thank you so much for all these like healthy lifestyle tips. I sure learned a lot about keeping a healthy and heart healthy diet, which is super important, especially at any age,
No
right?
problem.
Hmm.
You're very right. And also,
Hmm.
I want to tell all the women out there to go make a well woman appointment and see your
Yeah.
doctor if you haven't done it in a long time. It's just, if not more important than getting a mammogram,
Mm,
and pap smear, but that should be part of your, you
your
know,
checkup.
daily thing. And it's not just, going to your OBGYN. OBGYNs are great and they're often a woman's only doctor for many, many years. But
Hmm.
as you get older, you should really have a primary care doctor.
Hmm.
OBGYNs are very busy with other things, managing a lot of GYN issues. So
Right.
you should see a doctor who's going to check an EKG and decide if you need a stress test and other things for your heart.
Mm, beautiful. Well, thanks again, Dr. Jen. It was a pleasure
No
having you on the
problem.
show.
Thanks for having. Yeah, it was so
Yeah.
nice to be here and getting to talk to you, Bonnie.
Awesome. Have a wonderful day.
You too. Bye bye.
Wow, it was so great to have Dr. Jen on the show today, and we look forward to her healthy lifestyle challenge this week. I believe in you all. Do it for your heart and cut out those processed foods and unhealthy restaurants and fast food vendors for an entire week. Feel the difference in the surge of energy that you will receive. And additionally, reminder to see your family doctor. Also, I hope you wrote down a list of those top healthy foods for your heart. As you know, the Healthy Lifestyle Meals app is designed so you can specifically create meals around any healthy food items that you wish. Also, it has a grading system that assists you to create balanced meals along 26 requirements, 6 of which are targeted specifically for your heart health. It is quite incredible. And of course, we will see you next week. So stay healthy, stay active, and be happy. Listeners should know this podcast is for informational purposes only and assumes no responsibility for how this material is used. While using any information shared here, please consult with your healthcare provider.